Good day to all and welcome. My name is Braulio Rosa. I am the Executive Director of the Broward County Bar Association. I'm pleased to have today with us Dr. Edwin H. Hamilton. Dr. Hamilton is being interviewed along with other doctors in celebration of Black history. This year, the 17th Judicial Circuit, along with Broward County Bar Association and the TJ Reddick Bar Association, are honoring frontline responders in light of the COVID-19 pandemic. Welcome, Dr. Hamilton.
Thank you.
So, Dr. Hamilton, let's get right to it. My first question to you is, please describe your medical specialty and why did you choose that specialty?
My medical specialty by training is that of a general surgeon. Of course, that's in addition to uh, being a family practitioner, but the specialty is general surgery. And of course, my hometown is Fort Myers, Florida. And when I was young, coming up, there was the local medical doctor had his office across the street from our home. And I would go over on occasion to speak with him and visit with him. So it was the general surgery specialty offered me an opportunity to uh, take care of patients acutely ill, accidents, uh, and different types of general surgical problems. And I felt that it would be wise for me to participate or be a practitioner of general surgery.
What can you tell me what the time frame was when you were involved in this, when you started your practice?
But it was back in 1962. Um, I finished medical school in 1959, and there were special challenges, of course, being the uh, only Black doctor at that time in Fort Lauderdale, uh, specifically Broward General Medical Center. It's now called Broward Health. At that time, it was called Broward General Medical Center. And of course, being the lone Black doctor, uh, surgeon at that time, there were many challenges that I had to overcome in the situation where, having been a practitioner at that time, and of course, I was able to, I was the chief of surgery elected by my peers there at Broward General during that time. There were challenges, of course, as far as emergency call, where at that time your participation was voluntary uh, without any kind of compensation, except the fact that that allowed you to be on the medical staff at Broward General Medical Center. And of course, at that time, we had multiple challenges with me having to participate as a minority physician. I was able to overcome in multiple areas during that time. Uh, I was the first African American to do general surgery at North Broward Hospital. Now it's Broward Health in Pompano Beach, as well as Holy Cross Hospital in Fort Lauderdale.
Can
So,
you elaborate a little bit, Doctor, on some of these difficulties you keep talking about?
yes, uh, to get the proper perspective, of course, segregation and discrimination were rampant. And of course, to perform surgery on someone other than one of your own was a daunting task. To deliver the medical care, to cope with the racial disparities and disparate treatment of Blacks regarding healthcare. And of course, the American Medical Association does say that the physicians should participate not only as a practitioner, but they should be involved in the community. And this is especially true when it comes to minority physicians. So as a result of that, we are able to, should be able to render the care in exemplary fashion and to get the uplift healthcare of the minority community, which involves getting people to know and to respond. It's a very difficult situation because of the mores that have existed for many, many years. However, it is incumbent upon the minority of Black physicians to participate in trying to increase and decrease racial disparities in regards to Black patients.
So, doctor, in spite of the segregation and the racism, as you had said, nevertheless, somehow you were able to get elected. You said as the chief of staff, chief of surgery.
Yeah, at Broward General Medical Center in Fort Lauderdale.
And what year
And
was that, doctor? And how were you able to make that happen, considering all the difficulties?
well, I think what the you know there were a lot of physicians who knew me, that, and I had been there on the staff and had done my job, as it were, in a professional and exemplary fashion. So it was that which included the some who championed my elevation to that particular position. And, I'm extraordinarily fortunate to have been, I was president of the Broward County Medical Association for 2 consecutive terms. And I was president of the American Cancer Society in Broward County during that period of time. So I consider myself to be fortunate to have been chosen or elected by my peers to participate and lend whatever I could in that particular realm.
Do you recall the year when that happened approximately, doctor?
1972.
Wow.
The goes back a ways, but anyway, it was that which gave me the opportunity to participate and to help the minority community. And one other thing I want to mention too, that is, I early on had uh, community health fairs at the park on uh, Carter Park. That we had annual health fairs and screenings for breast cancer, prostate cancer. Specialists would come out to the park, and we would have sort of a hometown gathering, and we were able to spread the word and get people to uh, get screened for cancer.
So transitioning now, doctor, can you describe a little bit the legacies of Dr. Mizell, Shirley, Sistrunk and Morris and their impact on Broward County and the healthcare system here.
Okay. As far as the legacies of those men uh, is concerned, Dr. Mizell was an activist who uh, was very active in the NAACP, and he had a hospital on Sistrunk Boulevard. The hospital was there because Black physicians were not uh, admitted to Broward General Medical Center. Now, Dr. Sistrunk was the eldest of all of those physicians, and he, according to this is oral history from Dr. Mizell, he told me that when Dr. Sistrunk first came to Fort Lauderdale, he was not practicing, he was waiting tables as a waiter down on a little restaurant in Northwest Fort Lauderdale. Dr. Shirley came afterwards, and he was a longtime practitioner who played a pivotal role in the desegregation of hospitals. And the same as Dr. Morris, who was my undergrad classmate at Florida A&M University in Tallahassee, Florida. They were pioneers, so to speak, and they had great camaraderie, great practices, and they were steady and played pivotal roles in the Black community.
Do you recall, Doctor, just kind of circling back, when did you start practicing in Broward? I didn't get that. Do you recall?
I started practicing in 1962, and I left after about 3 or 4 years and went and completed my residency in general surgery. That afforded me the opportunity to, expand and help and in educational programs. So I might add too that in addition to my medical degree, I have a Doctor of Ministry degree, which is earned. And in addition to that degree, the book that I wrote for I did write a book based on my dissertation, The Health and Wellness Ministry in the African American Church. And the African American Church is a mainstay in the Black community. And we have come a long way, but that will give you some insight into the various desegregation initiatives in the Black community. And it has stood the test of time as far as the breaking down of barriers in the community.
Doctor, let's segue to today in the medical profession, specifically related to COVID-19, the various vaccines. How can doctors and other medical professionals convince Black community that the dangers of the COVID-19 dangers and the efficacy and safety of the vaccine?
Uh, for example, with uh, a Black practitioner who has a following patient load, that is, he or she is able to instruct and give uh, relevant information to his patients. so that he or she will be able to uh, take the vaccine without any hesitancy. Uh, I'm sure, uh, for example, in years past, the Tuskegee experiment, where there were uh, black men who were basically uh, hesitant to get the screening for syphilis, basically because of the disparity that existed at that time, whereas the blacks were not treated effectively because of the inability to get the tests necessary. And that's something that is truly, uh, even to this day, you find pockets of people saying that they did not get the treatment because screening because of insufficient information that was given to the uh, minority population. But as far as the COVID is concerned, uh, it's a matter of continually educating those of us who, uh, through those of us who are able to get uh, information out to our patients. Um, there are innumerable ways that we can do that. So it is incumbent upon those of us who are uh, able to uh, let people know what we should be doing, and it is a day to day and almost moment to moment situation where we are able to come together and have screenings for the detection or early detection, I should say, of these diseases. It's not easy, but it's doable, and we got to be vigilant and explaining in this program through the uh, Broward County Bar Association is a very thoughtful and worthwhile endeavor.
Doctor, what advice would you offer Black youth interested in pursuing a medical career?
Well, someone asked a question: when should I start studying to be a physician? And the answer to that is now, NOW. Start now. And then when you get along the way, it will be much easier for you to do that.
Well, thank you, Doctor. I appreciate you taking your time. I know you're very busy. I very much enjoyed interviewing you, and be safe, take care of yourself, and I hope to see you in person when we get through this pandemic.
Okay, I appreciate that. And thank you for being, supportive in this effort to get the information out to the public because we've come a long way, but we still have a great way to go. So again, thank you for your time and guidance along in this endeavor.
Absolutely. Thank you. And to our viewers, thank you for spending time with us. Have a wonderful day.
Thank you.